Tobrex drops are used to treat eye infections caused by bacteria. It belongs to a class of drugs called aminoglycoside antibiotics, which work by stopping the growth of bacteria. It's important to note that Tobrex drops only treat bacterial eye infections and will not work for other types of eye infections. It's also important to use this medication only as directed, as unnecessary use or overuse of any antibiotic can decrease its effectiveness. The daily dosage and optimal timing for using Tobrex drops should be determined by a healthcare professional. When using Tobrex drops, it's important to follow the proper application process. Make sure to wash your hands before applying the drops and avoid touching the dropper tip to prevent contamination. If you wear contact lenses, do not use them while using Tobrex drops. Make sure to sterilize your contact lenses according to the manufacturer's directions before using them again. When applying the drops, tilt your head back, look upward, and pull down your lower eyelid to create a pouch. Place one drop into the pouch and then gently close your eyes for 1 to 2 minutes. Applying gentle pressure at the corner of your eye can help prevent the medication from draining out. Repeat these steps for your other eye if necessary. After using the drops, replace the dropper cap and do not rinse the dropper. If you are using other eye medications, wait at least 5 to 10 minutes before applying them to allow the Tobrex drops to enter the eye first. Use Tobrex drops regularly at the same times each day to get the most benefit from it. Even if your symptoms improve, continue using the medication for the full time prescribed to prevent the infection from returning. If your condition persists or worsens, be sure to inform your doctor. If you experience tearing, redness, discomfort, or itching/swelling of the eyelid, it's important to let your doctor or pharmacist know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Using this medication for prolonged or repeated periods may result in a new fungal eye infection, so be sure to use it only for as long as prescribed. If you notice new or worsening symptoms, contact your doctor. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. It's important to know that if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Tobrex drops, make sure to inform your doctor or pharmacist if you are allergic to tobramycin or other aminoglycosides, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have other eye problems. After applying Tobrex drops, your vision may become temporarily blurred or unstable, so it's important to avoid driving, using machinery, or doing any activity that requires clear vision until it is safe to do so. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using Tobrex drops. This can affect how well your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's essential to consult with your doctor before starting, stopping, or changing the dosage of any medicines. Always follow your doctor's guidance to ensure the safe and effective use of Tobrex drops. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms such as passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. This medication is for your use only and should not be shared with others. It has been prescribed specifically for your current condition, so make sure to throw away any unused medication after your treatment is finished. Do not save it for a later infection unless your doctor instructs you to do so. If you forget to use a dose, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the usual time. Do not use double the dose to make up for the missed one. Make sure to check the product package for specific instructions on how to store Tobrex drops, or ask your pharmacist. It's important to keep all medications out of reach of children and pets. Do not flush Tobrex drops down the toilet or pour them into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard this product. You can consult your pharmacist or the local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.